Hello everyone, today's video is about infants choking, which is kind of scary. In fact, it's one of parents' biggest nightmares, I think. So we're gonna go over a couple of things. This is not actually a real baby, although it does kind of look like one. First of all, we want to talk about, it is a good idea for you to take infant and child CPR, just the basic life support, BLS. Make sure it's an American Heart Association certified course. And I would recommend that. I personally just took the Pediatric Advanced Life Support today and it reminded me of all these things, so I wanted to share them with you. One of the most important things about choking in infants is to prevent it in the first place. Now, you know children will get into anything, so you can't always help it, but at least for everything that you can do, try to prevent it. I've seen so many babies get into dog food and just all sorts of stuff, and rocks, and lots of different choking hazards like that. But things you can do to prevent it. Grapes, I'm very worried about these guys because they're exactly the size of the trachea or the child's airway. So make sure you have them or even quarter them until the child's pretty old, as in maybe 4 or 5 years old. Make sure to take time to remind them to chew before they swallow. Also avoid known choking hazards like a chunk of a raw carrot. So this is the only problem I have with some of the baby-led weaning philosophies we see a lot these days, is that they'll offer an infant maybe a large, long carrot, which could easily break into a choking hazard size hard vegetable that could get lodged. That's worrisome. We would also avoid round chunks of hot dog, round chunks of steak, hard candies, popcorn, bubble gum, nuts, and I don't know if you noticed, I had my little audio, or my visual aid in the background there. Balloons. Balloons are terrible. Marbles are terrible. Marbles just don't give, and they're exactly the size of the airway. Balloons worry us because if the baby bites on it or puts its face in it, and if it pops, that latex can go down to the airway and then perfectly mold to the size of the trachea, and then you really can't get it out, and that's quite worrisome. So I wanted to review with you today just the very basics of infant choking and what to do in that case, and older kid choking. And so having just taken pals today, this is all fresh in my mind, so we're going to use our pretend baby here. If your baby is alert but choking, this is what we're going to start with. Now remember, if your baby is crying and it sounds normal, and if your baby is coughing and it's a strong cough, you're still okay and don't have to intervene. Just continue to watch them closely. But if your baby is still awake but not crying, not making noise, and is choking, gagging, can't seem to get their breath, then you want to place the baby over your forearm, basically, holding its face in support, but not crushing the soft tissues of the neck, of course. And then you can even use your leg, your knee, as support. Make sure the baby's head is slightly lower than its body, and then you're going to deliver 5 quick back blows with the heel of the opposite hand in between the baby's shoulder blades. So head slightly lower, 1, 2, 3, 4, 5. And then make a baby sandwich and just flip the baby back and then lower it again on the other knee so that the baby's head is again slightly lower than the body. And then you're going to do 5 chest compressions just like you would do in infant CPR, just below the nipple line. 1, 2, 3, 4, 5. And then you continue, always supporting the baby's head and neck, to flip the baby. 1, 2, 3, 4, 5, doing back blows and chest compressions until the object is expelled, unless the baby goes limp, and then you begin routine CPR. Now, the only difference between routine basic life support CPR, and also at this time, if the baby becomes unresponsive and limp, you would want to notify EMS. So hopefully if there's someone else there, you could tell them that. If there's no one there, you need to do 2 minutes of CPR and then contact EMS. But everything changes once the baby goes limp and is unresponsive. And the only difference between just your basic one CPR provider, which is 30 chest compressions, 2 breaths, is that before you give the breath and you're adjusting the airway, then you can check for the foreign body. If you see a foreign body, you attempt to remove it. Do not do a blind finger sweep. That means if you can't see the foreign body in the back of the throat, you don't just stick your finger in there. That is not a good idea, okay? So all we did was alternate back blows and chest compressions while the baby's alert. And if the baby became unresponsive, begin CPR. And if you were all by yourself, did I say 30 to 2? It would be 30 chest compressions and 2 breaths. But when you have two CPR providers, you would do 15 compressions and then 2 breaths. And then check before you do the breaths for the foreign body. No blind finger sweeps. Now, let's talk about an older child. Thank you, baby. For an older child, you would do abdominal thrust, known as the Heimlich maneuver, and you would just make a fist with one hand, and with your thumb side of that hand, you would put it above the belly button and under the ribs, and then take the other hand and put over that hand and just perform a quick upward thrust. And then do it several times until you expel the object. In the same way as the infant, when the child's alert, you continue to attempt abdominal thrusts. And then if the child becomes unresponsive and limp, then you begin routine CPR, still checking for the foreign body before you give the breaths. And in infants or children, if you're alone, it is always 30 compressions to 2 breaths. If you have 2 rescuers, it's 15 compressions to 2 breaths. Now, this is not counting as your American Heart Association certified course here. I want you to take that. I'm encouraging you to take that. And obviously, as always, this is not your personalized medical advice. This is just general medical information and recommendations. Avoid choking hazards and know what to do if your infant or child does have an episode of choking. I hope you guys found that helpful, and if so, please subscribe to the channel and give this video a like. Thanks.